Spring is in full bloom at the Home Depot, so what are you working on? If you're digging into your garden, come into the Home Depot's Garden Center, where we can help you pick out the best plants for your space. Then make sure you give your plants the proper soil and support they need to thrive, like Miracle-Gro 25-quart potting mix on special buy 2 bags for only $15. It's formulated to help your plants grow and keep them fed for up to 6 months. Shop spring savings happening now at the Home Depot.
Hello there, I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in school and at the bedside. Welcome back to Mo's Monday Minute, my quick short episodes I release on Mondays that share a tip or some kind of helpful advice that you can start incorporating into your practice right away. And today's Monday Minute is about the most vital of the vital signs. You've probably heard this kind of, I guess it's kind of I don't want to call it a joke, but it's kind of said in a jokey way sometimes about nurses not actually counting respiratory rate and making kind of a joke that all the patients have a respiratory rate of 16 or 18 or whatever that is. And the reason that that is such a prevalent kind of joke in the nursing world is because very, very often, respiratory rate is not counted fully, not counted accurately, and sometimes, in some cases, guesstimated or completely made up. There are studies that show respiratory rate is the most regularly and consistently misdocumented, misassessed vital sign. But when you learn and realize that tachypnea, or a fast respiratory rate, is an early sign of clinical deterioration, counting respirations for real becomes a lot more important. So here are some tips for assessing respiratory rate accurately. First off, to accurately count respirations, sorry to say, but you must count for a full minute. And I know in nurse time, 1 full minute is an eternity, but you got to do it. So get in there and count your respirations for a full minute. Another tip that I share with my students in the clinical setting is that it can be really awkward to stare at a patient's chest, especially a lady, to just stand there and stare at their chest for a full minute. So what I like to do is stand a little bit to the side, so I'm kind of looking over their shoulder while I do it so they don't feel vulnerable or weird about what I'm staring at. Okay, so that's another little tip. And then a third tip is to count the respirations as you assess the radial pulse. So the reason I like to do it this way sometimes is if the patient knows you're counting their respirations, they're probably going to alter their breathing pattern. And what you want is an actual true respiratory rate. So if you pretend you're doing something else, then they're not going to alter their breathing, hopefully, and you can get an accurate count of their respirations. So there you have it. There's my quick tip for you this week. Count those respirations. And when you do notice tachypnea, I want you to start thinking about, could this patient be having some clinical deterioration? What would be the possible sources? What would be the possible causes? What can I do about it early before this patient totally turns the corner and goes the wrong direction?
This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Buying a new mattress sounds great. Paying for it? Debatable. Hear us out. At Mattress Warehouse, we offer 0% interest financing over 2, 3, 4, or 5 years. And we guarantee you'll pay the lowest price available, and we'll keep that promise for a full year after purchase. Go ahead and buy that mattress of your dreams. Mattress Warehouse has you covered. So where would you look to find the perfect mattress? In a little mattress store or Mattress Warehouse? Visit mattresswarehouse.com.